sort of set the scene on where we are now. So currently in Cuyahoga County, we still are at a total of 3 cases, 2 male and 1 female. The age range of these individuals is, all these folks are in their 50s with onset dates of illness between February 29th and March 7th. 2 have associated travel history on an Egyptian cruise, and 1 attended an IPAC policy conference at the Washington Convention Center. All had confirmed exposure to COVID-19 cases, and all have been in self-isolation since testing positive. None to date have required hospitalization. So what we've been doing very actively in the past couple days is active contact tracing, identifying individuals that they came in close contact with in that 6-foot range where there could have been coughing or other communication of risk within that range for some extended period of time. We are in the process of still working through that number, and we want to report with confidence the number when we feel we have our hands around the number of close contacts. So that's something that will be coming very soon, and we'll certainly keep you posted. But the work we do around identifying cases, around diagnosis, isolation, and contact tracing is done in public health as very much a routine disease response capacity. And so we're comfortable with that process, beginning to try to reduce risk as much as possible. We have not provided information on the individual locations of these folks because we want to protect their health information. We heard Governor DeWine's report just yesterday about recommendations on large gatherings. We know that this is not a new report because last week the governor actually made some recommendations on the Arnold event in Columbus. And I think this shows some leadership from the governor in terms of helping to set the tone in response for handling this evolving situation very quickly. So the state has recommendations around barring visitors to state prisons temporarily, canceling in-person college classes, conducting sports events without crowds, screening students who travel internationally during spring break. We don't want people to be anxious about this. We want people to understand and be educated. We want them to be ready. And the idea is mass gatherings based on guidance from CDC, the guidance that was created in the wake of the 2009-2010 H1N1 epidemic. They learned a lot. They learned a lot about what worked to reduce transmission. So the idea here is congregating people together in places. You sort of weigh the disruptions and the benefits of reducing these risks. And these recommendations, I think, help the state, that is every locale here in Ohio, to make decisions about what is best for them as this response to this pandemic continues to unfold. We'll talk again about the at-risk folks. Who are we worried about most? We're concerned about seniors. We're concerned about people with chronic illnesses like heart disease or asthma. We're concerned about people that may have limited lung function or people who may be immune suppressed because they're going through cancer treatment. These are at-risk people. If we look at what's happening in Seattle, we're seeing the long-term care facility as a real focal point, and that demonstrates the risk. We're not seeing as many kids, but we certainly know that those folks who are fragile, which is not dissimilar to flu, are more at risk. So we had a call yesterday, a very productive call with our superintendents from public and private schools yesterday, and we were very encouraged. As educators, they wanted to be informed, and we shared the CDC guidance with them. So there's some important things that we shared, places for other guidance for schools around get ready for pandemic flu. Those are documents created by CDC for a whole bunch of audiences, for educators, for school settings, for businesses, for the general public. These are great places to go to learn about things you can do to be prepared, and it goes back to those standard messages around hand washing for 20 seconds, surface cleaning, cleaning frequently touched surfaces like door handles and doorknobs, shared computer terminals in office settings, planning around opportunities to work remotely. We see decisions even being made at the university level in real time about having remote classes. These decisions are disruptive. It's recognized certainly that that's the case. But what it's doing is preventing people from gathering together to potentially transmit and spread COVID-19 more broadly in communities. This is a way to try to blunt the epidemic curve. We saw it play out in China, the huge number of cases that occurred in Hubei province. And so that is a cautionary tale for us in terms of what we can do here in the United States and what people are doing around the world to try and to some degree limit movement, but do that in coordination with the public so that they have good information about how to protect themselves, their family, and their coworkers, and to try to move through this process in an organized way. So some of the discussion points we talked about is some of the decision-making processes around early dismissal, cancellation of events, and closure of buildings. And we had a discussion using the CDC guidance. The risk that they might expose older people. Grandparents may be caregivers for these children when they come home from school. Keeping children out of school may also so we want to bear that in mind. And we know that elementary schools have different considerations from the pandemic guidance than colleges do, which is why colleges are making decisions based on the history of what happened during H1N1 and transmission at the university level. So during H1N1 and transmission at the university level. So we are encouraged that it appears that rates among children are much lower at this time than adults. Again, the high-risk population we talked about is certainly very much on our minds. So as the situation progresses, we need to continue to assess this daily. I can't say in 30 years in public health I've seen more of a fluid situation in terms of a daily basis, how this is evolving and then the context and using good public health practices in collaboration with partners to make good decisions. So what we've been talking about is that the school closure guidance and decision making is a tool in the toolbox for public health, working with our superintendents in our communities. At this time, we just need to continue to pay attention. The governor has said at this time, he has not recommended school closures. I think we can expect more leadership from the state level. I think we have a very strong and capable state health director, Dr. Amy Acton, who's working in unison with local health departments across the state of Ohio and in coordination with CDC. We also are still investigating a range of close contacts associated with the three folks that we mentioned earlier, the three cases, and we're happy to date that there haven't been hospitalizations. And so we're going to continue those discussions. Also, schools, we're interested in talking about activities in the spring that may involve bus trips, involved in activities in the spring that may involve gatherings around musical concerts. I have young kids and used to live through long sessions of trumpet sessions that have since passed, thankfully. And so in that regard, I think we want people to understand that we're going to make these decisions on a case-by-case basis, the context of who's attending, and work very closely with the superintendents to provide some support on the best way to come to consensus. The real issue here is to watch what's happening in Ohio, watch what's happening in Northeast Ohio, watch what's happening in Cuyahoga County, and try to be prudent about how we come to consensus. And so, bearing in mind these disruptions, we also are bearing in mind the public health messaging about trying to do what we can to reduce the chain of transmission in this community. So I think those are my main messages that we have right now for you. We're going to continue to meet with people. We've been talking with our emergency responders, our safety forces, who may certainly be concerned. They respond to take care of all kinds of sick folks in the community. And so we're going to continue to talk with them about precautions and some guidance for them as they continue to work in the community. We also know that masks are important for first responders. Masks are important for healthcare workers. Masks are not indicated for healthy people. And so people out purchasing masks from the internet and taking away the availability from those that most need it is not part of the solution. We want people to be part of the solution and make sure that those masks are available for our healthcare workers and for our first responders. We also want to tell you that we have been hearing about a number of internet scams, and a number of you have reported on those. So people are getting emails about click on this link to get a vaccine, click on this link to get a COVID-19 treatment. We know right now there is not a treatment for COVID-19. We also know that it could be as much as 18 months before we have a vaccine available. So please spread the word about avoiding those scams, particularly our elderly residents who may be preyed upon. So those are my messages right now, and I think right now I'd be happy to take some questions if you have any of them.
When it comes to the 2 weeks,
Yep.
quarantine and such, can the county force people to self-quarantine?
So you said the sort of the magic words around the self-quarantine is right now, in terms of close contacts, people are supporting that. People have been very cooperative. They don't want to expose their family members. They don't want to expose their workers and other people in the community. And so we've also seen, in terms of contacting people who may have been in close contact with cases, is they're sort of watching the reports that you're putting out and listening and getting educated about guidance and making good decisions. So we're going to continue to monitor that, but these are among close contacts. These are self-quarantining situations, and we to date have had good cooperation with people. And we expect that that'll be the case. We learned during the H1N1 pandemic that when there were discussions about the fact that we knew it would be 8 months, and I was deeply involved with that, 8 months before we had a vaccine, there were public discussions around the country about who should get it first, which meant that some people would have to wait. And what the public said is we want safety forces. At that time, there were pregnant women that were at risk and others. We want them to get it first, and we were willing to wait. So to me, that's an indication of the American spirit that we want to be part of the solution. We want to help to try to address people most at risk. Similarly, here with COVID-19 around self-quarantine, people have stepped up to say, we want to help, we're willing to work and to stay home to protect the community and ourselves. And so we're heartened by that.
I'm wondering, yesterday we had asked the Board of Health for the names of schools attended by children who were on the bus with one of the 3 confirmations. And, by not releasing the names of the schools, isn't the Board of Health depriving parents of information they need to know whether their kids came into contact with potentially exposed other children?
So if we look at other infectious diseases, whether we're talking about HIV or hepatitis C, or my experience with Ebola, where we had contacts that we were tracing in the community, that there was a lot of stigmatization that was occurring at the time with people in those circumstances. Certainly the history around HIV, we do not release specific information around HIV or hepatitis C. If we look at a range of infectious diseases, we're protecting the public health information and the rights of those individuals. And we're staying in contact with people that may need to know relative to close contacts. But I think stigmatization is a real fear. And I think we have a responsibility from public health to protect that health information for folks. And we intend to do that.
And I get the individual concerns there, but what about, you're talking kids potentially going back to school and associating with other kids. What about talking about those institutions that might be touched here?
Well, we certainly were on the phone with almost 100 superintendents yesterday, so they understand where we stand on this issue. And I think the other side is that if they are close contacts, they're not there at school. They're at home, and they're going to be at home during that incubation period. So we feel like we've addressed that to the degree possible. We don't share information about people that are HIV positive in the community and where they happen to live and in what communities they reside. We think that this is good public health practice. Next question.
Are you able to do your own testing? How many people have you tested, and how readily available are tests? I've read in Pennsylvania they literally tested 7 people in the entire state.
Right. So as you know, there have been some challenges nationally with ramping up testing capacity. So here is where we're at in Ohio right now, is there are 2 pathways for testing. If you are very ill and you meet the CDC guidance for being tested, then you will work with a clinician, will work with the health department and the state health department, and we will arrange for shipment of samples directly to the state health department. and the turnaround time in those results is 24 hours. The state reports that they currently have the capacity on the kits they've received from CDC to do about 300 to 400 tests. More tests will follow. We also have a second tier of testing that happens in the clinical setting, and there are two labs right now, national labs, LabCorp and Quest, that are working with area hospital systems, and they're able to order tests again on CDC criteria for those that are less ill or a bit less at risk than those that are maybe have their samples shipped to the state health department. And so those samples move through their normal testing procedures for other conditions within hospitals. It may take 3 to 5 days for those results to turn around. So what that does is begin to increase our capacity of testing. And as I've said multiple times, as we begin to test, if you seek, you shall find. There'll be evidence of cases. And I anticipate in the coming days that we'll continue to see more cases in Ohio because testing is ramping up. I would say over the next week to two that we will see that curve around testing increased more broadly. We'll begin to see testing spread out, but there's been a delay, and the delay I think we're now seeing as we test that the evidence of cases will become more apparent, certainly not just in Cuyahoga County, but across Ohio.
Still sounds pretty disappointing, those numbers, though.
Well, I think, yeah, we would have liked to have more testing, certainly. I think that we understand the ramp-up process around the country. A lot of the testing, I think, has started in places where they had airports that had direct transport from areas where there were areas of concern. So areas around China where cases were first recognized. So we think it makes sense that they should have the testing first because that's where the risk is. So you have to tier these, not dissimilar to our discussion earlier about vaccines, making sure that the folks that need it first where the risk is highest makes sense. I think given what's happening in Seattle, we understand their need to have adequate testing there to get their hands around what's happening, the fatalities associated with the long-term care facility. So I think those are important considerations, and we have to be part of that solution. Yes.
Do we know how many hospitals or which hospitals have sent tests to LabQuest?
No, I think you'd have to ask the hospitals. That's a clinical, many of those clinical
Are you not
decisions.
keeping track of that?
So what happens is that we have a disease reporting system where every public health tracks lots of diseases. Salmonella, we address influenza. We have a range of other reportable diseases that come in through a disease reporting system that is connected to the state health department. So those results will come back to us through that mechanism, which is how we normally do business.
What,
Yes.
if any, recommendation have you given the governor on whether to close K through 12?
So I think the governor has a very, very capable physician in Dr. Amy Acton who's working closely with her. The key here is they're connected to the CDC. And in those discussions, they're looking at the national picture. We really need to understand how this is evolving, not just in Ohio, not just in the Midwest, but around the country. And so we're on calls on a regular basis, health departments and the state health department with CDC, and sort of walking through this. And the idea here is we are watching this situation evolve. And we're going to be making decisions on using that pandemic guidance from CDC on what we think the next tier of action may be in order to limit spread. So these are daily conversations. And I think the governor, has shown leadership in addressing this public health problem. We're grateful for that.
It seems a bit unsettling, though. I have a 16-year-old who came home and said, all the extracurriculars are canceled, but I'm still going to school,
Yeah.
sitting with these same kids.
Yeah, well, I think the decision around, I think I described earlier, around this issue, considerations on school closure and sort of a tiered approach is I think the model that we're currently following based on evidence. The model is imperfect, but certainly we're looking at trying to make the best decisions, judicious decisions, to try to do what we can to reduce the greatest risk, and that will continue to evolve going forward without question.
So you, going back to Stacy's
Yeah.
original question, you do anticipate the number of cases to go up as testing continues?
Yes, we anticipate that there'll be more cases in Northeast Ohio. We anticipate that there will be more cases in Ohio, and I think that's certainly a national, we are in a national frame where we're going to continue to see more cases.
Do you have any idea of maybe how bad or how many it could increase to?
Yeah.
Or
I think I can't speculate on that. I think as we look around the country, there also, actually, it occurs to me there may be some good guidance about what's happening internationally. There are decisions being made in other countries based on the scope of their outbreak. Some appear very severe, disruptive, but I think we are taking this on a case-by-case basis, a stepwise process here in Ohio, and bringing everyone together to make good decisions. But I can't speculate on what that will look like. We're going to do what we can to try to blunt that pandemic curve, to try to break the chain of transmission as best we can.
Back to the school thing, are you saying that, like her question, or whoever's question about, extracurriculars are out, but I'm still sitting in class, is that kind of decision up to the superintendents, or are you telling them what to cancel and what not to cancel?
Yeah, we work in unison with the superintendents. So we are not dictating closure to people. I think what will happen is that at the state level, the governor will show leadership in making decisions to help people have a frame for decision making as this pandemic progresses.
I'm just wondering locally, as far as your efforts, contact tracing, seeing who came into contact with who here in Cuyahoga County. Have you guys, going back to the one gentleman who was on the bus, have you guys identified everyone who was on that bus with him?
Right. So where we're at right now is we've got a legion of staff that have been working long hours contacting people to ascertain what those close contacts are. So those are conversations with individuals. How far away were you? What sort of time did you spend with them? And begin to ascertain that. We're still working through those, and we want to report with confidence on what that number is. So it will come. We just need a little bit more time. Yes. I thought I had another question. Okay.
So colleges are going online with teaching, but last night I saw a huge party going on. You obviously don't want to make it look like that might, I don't know if that backfired is the right word for.
Yeah, well, so we do the best we can to try to message in a free society. And so for me, I think it's particularly important when a governor makes a statement about what recommendations. It shows leadership and it helps local context for decision making. I think we're going to do the best we can to limit those places where transmission can take place to the degree possible, certainly.
You've mentioned that there's been an increase in the number of calls that you're receiving for coronavirus.
Yes, that's
and at this
true.
point it outpaces the flu. What kind of questions are you answering from people? What are the biggest concerns in the community?
Well, I think people ask about whether there's a vaccine. People ask about whether there's a treatment. People wonder about trips. That happens a lot. We have a trip planned to go somewhere in Europe. We have a trip planned to go somewhere in the continental United States. And what should we think about in determining whether we want to take that trip? So I think those are a lot of the calls that we're getting. I think they sort of come in waves, certainly. And so we appear to be getting those people that may be concerned about some of their fragile relatives and what they can do to try to help to protect them. And so those are the calls I think we've been getting a lot of. And so we want to help people understand where they can go to get good information. So we want people to go to trusted sources. We know that there are a lot of internet scams out there. We know on social media there is misinformation. I think that can scare folks. No surprise to all of you. And so what we recommend is you have a website at the state level, coronavirus.ohio.gov. You have a statewide hotline that helps to support our activities here. And that's 1-833, the number 4, ASK-ODH. 1-833-4-ASK-ODH. And they've got that staffed 11 hours a day, 7 days a week. So we're working in unison with them. We also have the Joint Information Center here, City and County Joint Information Center open at the Emergency Operations Center, working together to deal with a whole range of questions that are coming from the public. And then what we do is the guidance is evolving from the CDC on a regular basis. We are reviewing that guidance, integrate that into messages, and then sending it out to sectors like school districts and safety forces and businesses, and making sure that people have the best information as this thing continues to evolve, and it is very fluid.
Are you concerned about the shortage of personal protective equipment? How's that going?
Right.
Do we have enough? When are we going to run out?
Well, I think we've been working very closely with our colleagues at the Center for Health Affairs. So that's the Hospital Association. And so what they've been doing is working with hospital partners to determine what their needs are, not just from the masks and the respirators and the like, but other medical equipment that they may use. And so the idea is there is that the Center for Health Affairs is serving as a clearinghouse to make a determination on what hospital needs are so that they can consolidate that information and share it with the state health department and other industry support groups to let it be known what their needs are, where they stand relative to supply. So that's their lane, and I think that we've got a great working relationship with them.
Terry, what would you tell people, when they call, hey, do I need to go buy 500 rolls of toilet paper?
Right.
I mean, just try to alleviate,
Yeah.
alleviate some of those.
Right. I think we've
Sorry.
Only you.
let's get a drink of water. Thank you for that.
Not to be too funny. That's
No, it's good. So going back to H1N1 flu in 2009 and 2010, even before that, some may remember in early 2000, we had a blackout that affected a huge portion of the country. I was around for that. We've had heat emergencies. We've had cold emergencies. We have tornadoes that occur in different places in Ohio and around the country. So what the general recommendation is that people are prepared for emergencies and have supplies on hand, just to be safe. This is a good practice. You've got batteries for your flashlight, right? We do this, right? Do you have food available, dry goods or frozen goods available? Are your medicine supplies available? If you are doing mail order, do you have 30 days of meds available? That's good practice anyway. So there's plenty of guidance on CDC's website about just generally being prepared for emergencies. And you also should have information and things available for your kids. The adults might cool their jets and watch Netflix, but the kids, have some books or things that the kids can do and games and things available for them. So if you have to sit back and sort of wait out something in an emergency, it's just good practice to be prepared. Have a plan on how you communicate with your loved ones. We know that that's important. Many of us communicate with our loved ones or seniors or people that live in our neighborhoods, checking on them to make sure that they're okay and their needs are met. So that's just sound practice. I think that we think is good to follow. Yes, ma'am.
Let's go back to the college campus this question. So with the kids not being in classes, they're in their dorms, they're at the cafe, they're in the library. So do you recommend they go home with their parents and stay in a little group, or where do the kids go to stay away from each other, basically?
Yeah. So I think those are the challenges with making decisions. I think right now I've got a couple college kids, and they're one is here, one heading home for spring break. So we're in this gap now, which is actually instructive. So we sort of look at what happens around this spring break period to make decisions about what the next steps are. We think people are hanging in their dorms, and you're in your dorm room and you're not exposed to a lot of different people in those times. There'll be messaging that comes from the universities back for students. This is a time where we are responding and developing guidance and messaging in real time. And so I think we're going to continue to do that to try to reduce risks. Guidance may evolve, and so we just ask people's patience and understanding that we're trying to give you the best information that we have at the moment. And if we know something new that's important for you, we'll be sure to get it out as soon as we can. We're committed to that.
I was going to say, is that kind of what's been a little frustrating, is that people want answers now, and again, you've said this multiple times, this is an evolving situation,
Right.
and things are changing all the time.
Well, I mean, I certainly understand, putting myself in the shoes of people that have questions out there, I understand that, those concerns. So for me, we just try to give the best information we can, but if we don't know, we're going to say we don't know. If we say that we'll have better information tomorrow or the next day, we're going to make sure that you know. And we want to commit to provide the best information we can, and as a health department, we think we have that obligation. But there'll be times when we can't say because we just don't know.
Did you say the number, how many people here in Cuyahoga County have actually been tested?
Oh, I don't know that number right now. What that number is? We know how many people have been tested through the state health department because they report it on their website. And also they report on their website the number of travelers that we're tracking across the state. But no, I don't have the number through the private labs. There may be some mechanism that you can roll that up at the state level where they might be able to look at that, but that would be a question probably for the state health department.
And how do you convince people that it's not a panic situation? You're very calm, we all try to be very calm.
Yeah.
Everybody perceives it as a panic situation.
Well, my philosophy from having done this a long time is that if you give people information and that they learn a little bit more about it, then it helps to calm people a little bit. Because information is power, I think. People learn things that they can do. They want to be able to act. And so guidance around at-risk people, our seniors and people with chronic diseases, they have information about what risks may be out there that they need to be aware of. During flu season, we don't want seniors spending time with a lot of sick folks. So follow the guidance, use the best information available from the Ohio Department of Health, from CDC. We have resources on the Cuyahoga County Board of Health website. And use that information, use that power to help to ease some of your anxiety. We think that's important. We want you to be ready. We want you to plan. We think that's the best philosophy.
Speaking of how many people have been tested,
Yeah.
how many people have the Board of Health in Cuyahoga County asked to self-quarantine?
I don't think that's the number we're still working on. That's the number where we don't have full confidence. Yeah, I don't have that number right now today. So I don't have confidence on what that exact number is today. But we will. Because we're working through it still. It's a fluid situation. We should have the number soon. And certainly you'll know when we do.
Is there
Yeah.
any concern that people are traveling and choosing to not self-quarantine?
Well, I think across the country, one of the best kept secrets in the country, in my mind, is the local public health system working with state health departments around a range of diseases. And there are other instances where people are quarantining, right? This is not particular to this event. Do I need to address this?
Oh, it's you.
It's my mom.
That was the governor. Hello, Governor.
All right, folks, so we got to wrap up and take one more question.
I'm sorry. What do you want to?
Yeah, so is there concern that people are traveling and not self-quarantining when they probably should?
Right. Well, I think we feel reasonably confident that people understand that they don't want to expose their relatives and their kids and their moms and their dads and their grandparents and their neighbors. And so we feel that people are making good decisions in self-quarantining. And to date, based on our conversations with people, I think that sort of validates that is the norm. So we'll continue to monitor that, but right now people understand that they want to limit risk to their family.
So you're confident in the general public?
I think,
to follow your guys' suggestions?
well, I think it depends can you be more specific about your
On
question?
self-quarantining specifically,
Right.
if you're confident that people who
Right.
should be self-quarantining
Right.
are.
And so the specificity there is we're talking about close contacts. If you have a case and people know that they were exposed to a case of COVID-19, I think people want to do the right thing. So the self-quarantine is not just the general public. These are folks who may have been exposed to a case, and I think they're making good decisions to protect their families.